Thank you for staying tuned. Across Nigeria, allegations of medical negligence are raising urgent questions about patient safety, professional standards and accountability in the healthcare system. From Lagos to Kano to less resourced states, families say routine medical care has over time ended in tragedy due to failure of the system meant to protect them. Our next report by Uche Ugochukwu examines what the nation is doing to safeguard patients and hold perpetrators responsible.
Hospitals serve as a vital hub in healthcare system. They mainly focus on saving lives and providing full care to patients. But people often wonder what could go wrong in a place with skilled experts and systems designed to diagnose and treat illnesses. Yet, patients still die or face serious health problems due to medical mistakes. This question is on the minds of many Nigerians, especially with reports of medical negligence in some hospitals across the country.
The doctor mistakenly tied, because she wanted to do a super ligation, tied some intestine or whatever, and that led to her death.
While in the hospital, you call the attention of the nurse would not respond. And even when they respond, there will be this sluggishness.
Same thing, I went for medical checkup. They said I should wait for the doctor. I waited. Later on, they say there will be no doctor to attend to me that day, till I should come the next day. What if I die? What if I couldn't make it to that next day?
As the death of novelist Chimamanda Adichie's 21-month-old son at a private hospital in Lagos is raising concerns among Nigerians, the case of Aisha Umar, a mother of 5, came to light. Her family claimed that a pair of surgical scissors was left inside her abdomen during a procedure, which caused her 4 months of severe pain and death. Experts say these cases show bigger system problems, not just personal errors. To back this up, the professionals said there is a weak oversight and poor enforcement of medical standards.
So let's empower the regulatory bodies to have manpower and the skilled professionalism to do regulatory oversight. And at the same time, on the part of the health professionals, let's advocate for non-punitive reporting systems so that we can even see what is the incident. Everybody needs to be trained a minimum of once in a year.
If you look at other advanced nations, these things happen every time. And the key fundamental difference is that when it happens, there is that element of transparency that is very crucial. And with that transparency, they investigate and then use the outcome of that investigation to ensure that the chances of that happening again is much reduced.
The Medical and Dental Council of Nigeria regulates doctors and punishes misconduct. But critics say it does not regularly inspect hospitals or enforce patient safety rules. This gap, analysts say, allows unsafe practices to continue in both public and private hospitals. Sadly, efforts to get the council to comment on this were not successful. Although victims can go to court for justice, do they really know how?
You need to know your rights as a patient. A challenge that we face on our side, we start, the patient comes, the victim comes, we take up the case, midway, they tell you, our community leaders say, we should leave it for God. So, and if we keep leaving it for God, we will not improve our jurisprudence in this area.
Added to this are underfunded public hospitals, lack of staff, quackery and weak emergency systems. Experts warn that patients face avoidable dangers because of these issues. They called for stronger rules, clearer laws on medical mistakes, and more funding for patient safety in Nigeria. Uche Ugochukwu, NTA News.